Hi, folks. Nice to meet you all, and nice to be here in person as well. I'm Ashwin Gunashekhar, founder and CEO at Zeto, and we are about taking EEG from the room to anywhere. A quick story about us. We were founded in 2014, got our FDA approval clearance in 2018. We raised about 16 million in total funding so far. We launched commercially during the peak of COVID, and we've gotten very fast growth in the last 2 years, nearing a few million in revenue. We're at over 200 healthcare facilities that are paying customers and over 35,000 clinical EEGs recorded so far. Our plan is to reach 50 million within 3 years in annual revenue and to build one of the largest, most valuable EEG databases. In terms of fundraising, we're close to closing our 25 million Series B to further accelerate commercialization and launch market expansion products. And we were also the winner of the UCSF Hospital Diagnostics category, UCSF Health Hub Awards in the Hospital Diagnostics category from last year. All right, so obviously there's no need for me to explain what EEG is useful for here. That'll be easy, but I think this would be interesting for you all. It requires a trained operator to measure, mark locations, glue down the wires, abrade skin, and whatnot. It is estimated that 35,000 EEG technicians are needed for the current demand today, and less than 3,000 remain in the profession. The pandemic further accelerated it. As a result, EEG is unavailable in most healthcare facilities. Besides the level 4 and level 3 epilepsy centers that are able to keep these EEG technicians, EEG is unavailable. And it's not also hard to guess that something as archaic as this does not have any cloud setup or remote reading capacity. So it's not just acquiring the data that's broken, it's accessing it and also interpreting the information that's broken. And that's where we come in. Our product is a comfortable, easy to wear headset with electrodes placed as per the 1020 neurologist system, EKG sensor, auxiliary inputs, photic stimulation built in, and live video streaming through the cloud. No software installs needed. You can open any laptop or tablet and it runs via Chrome browser or via an app. We also have live monitoring and interpretation service through our third-party partners for live monitoring and interpretation by a board-certified neurologist. So we provide a turnkey solution to our customers. So imagine a rural hospital that does not have access to EEG. With Zeto, they have a turnkey solution overnight. And then, of course, we have data management to HIPAA compliance standards, to hospital standards. And last but not the least, we have third-party API that we allow other companies to build applications on our platform. So they are able to use our EEG infrastructure and securely use all our information to build diagnostic. Example, oh, I have something for stroke, or let's say cannabis detection. So this is our product in hospitals and clinics right now. In the top 2 pictures, you can see it's over intubated patients in the ICU. The top right is in inpatient setting. And in the bottom, I'm also showing how our headset fits down to children in outpatient settings. So here is the headset itself. It has it should be working. It has single-use disposable sensors. We sell those in as a single-use consumables. The headset itself is a durable equipment, which is cleanable. It touches intact skin, so it just needs to be wiped down with an alcohol wipe. And what else can I say? There is a lot of technology here, from noise cancellation, noise shielding, and comfort, and 1020 positioning. It opens and closes on 5 different bands. Uploads to the cloud directly or through a little dongle that we provide, and everything is done on the cloud. happy to show you guys after the meeting as well. So the way we look at the market, if you look at the current EEG solutions, the wires and the glue, the market is limited to circle zero, which is neurology departments and neurology offices. Once we introduce this product, the customers who've been waiting for a solution have come out, like from ICU monitoring to ED assessment to remote monitoring to pharma clinical trials, which are distributed, and neuromodulation assessment. Talk about TMS treatment before and after they need EEG, right, to quantify their treatment. And we have a Gen 2 product that's coming out next year that'll open up telehealth. We'll be able to send the product out to customers' homes for continuous monitoring, primary care physicians, even cardiology segment, and then home monitoring. Just like EKG, where EKG was stuck to the hospital 40 years ago, then came the Holter monitors, and then came now the patches with arrhythmia detection on the phone. EEG will take a similar path, except that it'll be faster because we're already in the iPhone age and the cloud age. We absolutely know and believe that EEG will become a diagnostic within check. So in terms of an ecosystem play, use this one. Yeah, we're a full ecosystem play with a full tech stack. Everything that's in green is already out in the market and delivering value. The ZEG headset is what I showed you. We have the cloud infrastructure that can handle over 10,000 uploads and downloads simultaneously. I told you about the streaming API that opens up third-party apps. We are working with about a dozen startups already in creating the EEG infrastructure for conditions as different as Alzheimer's to autism. And then we have one of the most advanced report writers already on the field, which basically makes our data information. All our metadata is informative. And it was developed by Dr. Robert Fisher from Stanford, who's our chief medical advisor. That was 30 years of his work. And we have other things like seizure detection already available. We hope to have computers reading EEGs by 24, 25 timeframe, at least most of it, which will be signed off by a physician. So it's a well-reimbursed procedure, multiple CPT codes for any outpatient setting, and it's covered by DRG for inpatient settings. It is brain monitoring, so as fundamental as it gets. And it's not just for seizures and epilepsy. It is the gold standard for sleep disorders, for post-stroke monitoring in a critical care setting, and lots of other conditions. The market itself, over 6 million routine EEG procedures are done annually in the US as per current procedural volumes. And just in the US alone, it's a $1 billion short-term EEG market. Longer-term EEGs are all the hospital EEGs, the ambulatory EEGs that are performed. And these are in terms of reimbursements, right? I showed you a 20-minute test is being reimbursed at about $400. So there is a good amount of money. And in the ICU, for example, 3 million procedures per year are not being served. This is from severe stroke to traumatic brain injury to cardiac arrest to sepsis to major cardiovascular procedures. These folks are not being taken care of because they cannot just do an EEG in the critical care setting, because who's going to come down and glue down the wires? So how do we sell? We sell, because we're a connected product, we sell both through a pay-per-test model, which is, varies from $65 to $125 based on volume. The higher the volume, the lower the price, all inclusive. And they can also pick add-ons as they need it. And then we have the typical purchase model as well, which is equipment, software, annual software, consumables per patient, and then storage and platform fees. In terms of competition, almost 95% of the market is still the old stuff. The glues and the wires, and that requires a trained EEG operator who's gone to school to do this procedure, and that is the biggest limiting factor. The market outside, there is a company from Stanford, Cerebral, They have 8 channels, the commercial stage as well. They raised a lot of money, and they've brought in a lot of awareness to the ICU space. And there are other companies that are non-clinical. They don't have sophisticated software to go into a hospital, but they have some electrode devices. Team, I'm a former electrical engineer and management consultant. Founded the company back in 2014. Gabor Braun is our CTO. He's developed real-time trading software for some of the biggest European banks, hence the power of a cloud. And Florian Strelzik, he was the general manager and chief sales officer at Brain Vision. He grew Brain Vision from 3 million to 12 million in sales in just about 3 years. And Dr. Robert Fisher from Stanford, he's one of the biggest thought leaders in epilepsy. For us, we have multiple exit opportunities. For us, what we are really after is making EEG accessible for healthcare and providing better diagnostic solutions, either of our own or in partnership with other smart companies, and enabling others to build great apps on our platform. So in terms of an exit, we could exit to a medtech player like Philips or a GE, or we can also exit to technology giants if we are a little bit successful with the Brainwave database. That's the company. All our intellectual property is owned within the company, and we believe we have the best shot at being the EEG solution of the future.
Okay, thank you very much, this one. And do we have any questions from anyone online? No? Do we have a, well, let me ask the first question, and then maybe someone else will have one. I'm asking the first question. Who else raised their hand? Victor. Oh, Victor, you're next. Sorry. So you mentioned Natus Medical, which is the 800-pound gorilla in the neurodiagnostic space, and they have a reputation for buying up a lot of their competitors. So my one question to you is, how are you going to avoid getting bought up by Natus Medical for several $100 million?
Why would I? I mean, first,
that was a trick question.
That they went private, right? And there's got to be a fit with how they see the world and how they want to grow as well. So they just went private, which means they're just trying to expand the margins, let go of people, expand the margins, and put them back public again.
Kind of like what Elon Musk is going to do, but that's another story.
So I don't see a fit right now, but hey, you know, if they come and put the right offer on the table, what am I going to do?
Their former CEO, Jim Huckins, had a formula for, you know, when it was accretive to Natus, and they were basically looking at, you know, could they add 50% to their in terms of the EBITDA that you're doing. It's a different world now that they've gone private, but there are other players. There are other large med techs, including some who've been in the neurodiagnostic space and have left. For instance, Philips, who divested much of its, I mean, they still have some products, but they divested much of it to Lothar in his previous life. That's because Lotar's a great negotiator and got it for a good price. But do you see any other large med techs as possible acquirers of your firm?
So we're a disruptive business, right? So if you go and ask someone prematurely, hey, would you buy an EEG company? They're only going to think amplifiers and wires, and they're going to immediately have a ballpark to a benchmark to Natus, right? There is a certain art to pitching a disruptive business at the the right way and at the right time. So once we cross the $15 million value revenue number, and we're starting to move big accounts in the hospital space, and we're opening up these new markets that were not familiar to EEG before, then people are buying us for the next growth spurt in their stocks. That's the Medtronics or the Philipses, and for either you fit in the connected care segment or in the critical care segment or in the remote patient monitoring segment. Those things are addressable not from a classical Natus standpoint, but from a new blue ocean standpoint. So that's what we're trying to do. And I think multiple medtech players would be interested.
Kind of a follow on what Jim asked. You mentioned at the beginning that one of your aspirations is to build a EEG database, and I assume you want to then sell it to others, to third parties. If you do that, would that require a sign off from all of your patients, or you own the data?
Yeah. So whatever we do, it's anonymized. So there is no patient sensitive information. Secondly, we sign very strong business associate agreements with our healthcare providers. So most of them ask us not to touch their data, right? But for a time series data like EEG, you don't need a whole bunch of millions of patients. You can really get what you need with respect to being able to find the events or the markers you need very quickly. And that can come from clinics who work with us, but we always give them the guarantee that's anonymized. And we work with pharma clinical trial partners who are basically looking for intelligence from the data, right? They don't want the EEG traces, who cares? They just want the information out of it. So